Welcome, everyone. My name is Shamtoli Haq. I'm the editor of Law at the Margins. For those of you who are not familiar, Law at the Margins is a social justice platform. Its mission is to curate and create social justice content, just like this webinar today. So we're really excited to have a wonderful panelist to talk about collaborations, multiracial and multicultural amongst anti-violence organizations and the impact of COVID-19. So a couple of, before I introduce our speakers and moderator, just a couple of housekeeping. We invite everyone to introduce yourself in the chat and let us know that you're here, what's your connection to the issue. I want to sort of give thanks to Morgan Moon, who's an associate editor and really put this program together. She will be live tweeting on our handle at Law at the Margins, the discussion. And if there are questions from there, you can also please feel free to live tweet. We're using hashtag DVCovid-19. And so with that, let me introduce our speakers. So first, we have Margarita Guzman, who is our moderator for this evening. Margarita joined the Mayor's Office to Combat Domestic Violence, now the Mayor's Office to End Domestic and Gender-Based Violence in 2013, and served as the Deputy Director for the Bronx Family Justice Center. Currently, she serves as the Executive Director at the Violence Intervention Program, which works largely with immigrant and low-income Latinx survivors of domestic and sexual violence. We're really excited to have Margarita back. Law at the Margins has collaborated with VIP Mujeres in past programs around intimate partner and sexual violence, and we hope to actually build on this, this area and collaborations. We're also excited to have Kavita Mehra, who is the Sakhi's Executive Director since 2017. During her tenure, Sakhi has seen their budget grow over 50%, although they'll talk about budget changes recently, and has launched a trauma-informed mental health program, a transitional housing program, a food justice program, and a second office in Queens. Prior to Sakhi, Kavita was the interim chief executive officer of the Boys and Girls Club of Newark and has held leadership positions in the GlamourGals Foundation, South Asian Youth Action, and Asian Women in Business. It's really a pleasure to have Kavita. I know her for many, many years as really a committed feminist advocate. We're also excited to have Zeinab Eyega, who is the Executive Director of Sakhi and has over 16 years experience working on issues impacting African immigrant women and girls in the United States and in Africa. Her commitment to the advancement of African women and girls was recognized by the Open Society Institute, and she was awarded the Soros Community Fellowship Award and has been recognized for her work with by the New York City Mayor Bloomberg during Immigrant Week. Incidentally, I was also a community fellow as well. I didn't know that. And then we are going to also be joined by Niketa Sheth, who has devoted her career to helping individuals heal and build new pathways to navigate life. She is the Chief Executive Officer of Womankind. For the past 9 years, she served as a member of the New York City Alliance for Sexual Assault Board of Directors, where she was the president for 2013 and 2016. She served as a senior vice president at the Christopher and Dana Reeve Foundation, the associate director at the Michael J. Fox Foundation, and a senior consultant for various nonprofits working on health and their impact in the community. So as you can see, we have a phenomenal group of activists to share their work that they're doing collaboratively with us today. And I'm really looking forward to hearing them. So with that, I'm going to hand it off to Margarita. Thank you so much.
Hi, thank you all. Thank you, Chamtoli and Law at the Margins, for the great work that you do to highlight issues like this. And a shout out to Morgan and Albert for your behind the scenes work in making it look like we know how to use technology. We don't. Can I just take one moment to ask my co-panelists to tell me if they can hear me clearly?
Yes, yes, we can hear you.
Great. Thank you all. Thanks. Affirmation's always great. So then I also want to thank my co-panelists, Kavita, Niketa, and Zeinab, for taking time out of grueling work schedules to share your wisdom with us. Y'all have no idea how hard it is to get these powerhouses together at the same time. So it really is quite a treat to be able to be in this discussion. We're all excited to share perspectives from the diverse immigrant communities and communities of color where we all work to address gender-based violence on a daily basis. And also thanks to the great community of folks who are listening in, and a quick shout out to our colleagues at Connect, Q and Sally, who I think are also on the chat. So because secrecy, hiding, and willful ignorance all play such a big role in the way that DV often gets locked behind closed doors, and we are often asked to shed light on what might be an otherwise unseen issue. And now that COVID has resulted in all of us being ordered to remain behind closed doors for more than 3 months, many people have been very concerned about what is happening right now. And of course, the answer to that question is complicated because many things are happening all at once. In addition to surviving the abuse of an intimate partner, our survivor communities have been abused by the government, hunted by ICE, beleaguered by poverty, and are now stalked by a deadly virus. So we are going to unpack this question sort of like a little bit at a time. And I wanted to start by setting the stage with the political climate faced by immigrant survivors at the time that COVID hit. And so for that context, I'm going to turn it over to Zeinab and ask her to start us off on that intersection.
Good evening. Thank you, Margarita, so much for this eloquent introduction and opening to this panel. And thank you for Lord theMargins for inviting me to be a part of this panel. I think this is incredible and it's critical conversation, and it's due. And what I would say about the climate, I think the political climate started in January 2017, and I think we knew when this new administration came into power, we knew that things were going to change for immigrant survivors and victims of domestic violence, but we didn't know how horrible they could be. And I think in the last 2 years, we've seen kind of a turning point from the rhetoric that you see in the news and hear to actual evidence of how victims are being either separated from the services that they duly require, to denial of recipient. For example, many of our survivors are afraid of actually submitting applications under VAWA, Violence Against Women's Act, because they're fearful that that will be denied, and then they'll come into the sights of ICE or the government to be deported. So that's one. And we've also learned with a lot of the current climate where, victims who used to work to get basic income are now afraid to go out to do, to get employment, because then they're not sure what, the employers would do. They're not sure what, who would be picked, and they're not sure, who they can trust. Not added to that dilemma is the fact that now, many of our survivors who are still living with the abusers are not willing now to report or even call, the police, or to go to the system, because now the system becomes the second arm of, the government. Because if I call 911, or if I go, to family court to get an order of protection, what will that mean for me and my family? What will that mean, for the government to come, after me? Now I've exposed myself. Now I'm deportable. So all in that, and then you have COVID-19. And of course, now we know that COVID-19 has really hit, low-income communities of color disproportionately than, other communities. And again, if you are a victim, DV victim or survivor, now you're also afraid of going to seek for medical assistance, or going to get yourself tested, or even, taking care of yourself, because many of survivors that South Yet to works with don't have access to PPE equipment, for example, or they live in homes where physical distancing is not, possible, because, again, you live in crowded homes. So physical distancing is not an option. And if you leave the abuser, where are you going to go? Are you going to go to the shelter? If sheltering, going to the shelter, are you going to be able to be physically distanced? So all of those questions come up that make many of the survivors, especially immigrant survivors, and those that are undocumented, have triple jeopardy, because it is the immigration, it is COVID, it is also the political anti-immigrant sentiment now that they have to, deal with on daily basis.
Thank you so much for that, Zeinab. I'm wondering if I can just ask you a really quick follow-up to what you were sharing, which is, and I know that we're all going to be talking about this a little bit, and then we'll also pause to see if anybody else wants to add to this. But have you seen, how do you think the combination of COVID and being an immigrant impacts the experience of domestic violence during the pandemic as compared to somebody who maybe is not an immigrant?
I think it makes it, being an immigrant and COVID, especially in the current anti-immigrant and the zeal with which ICE and the administration want to really deport and kick everybody out, makes it much more fearful for immigrant survivors to speak up and seek help. And, at least in our experience, we've had actually severe cases of domestic violence where actually the victims have refused to allow us to take them into shelter, have refused to allow us to even call, make a police report. Because now you have to deal with either, you report and you expose yourself to the system and now you're deportable, or you suffer in silence and you suffer and your life might be in jeopardy and the life of your children might be in jeopardy. There are two choices that no one should be forced to make.
That's right. Thank you. And that's something we saw a lot at VIP, was people making these impossible choices between, additional risk of exposure to the virus and additional exposure to other forms of oppression that can have unintended consequences, especially related to immigrant status. I know that Nikki will be joining us, Niketa Sheth from Womankind, in a few minutes. But Kavita, is there anything you would add to that before I move on to another topic, another intersection to unpack?
No, I think that was so beautifully said.
Yeah, thank you. And I feel like this is one of the constant and terrible ironies of doing work within immigrant communities, is that immigrants usually come to the United States for better economic opportunities, right? Only to find that once they arrive here, that sort of whole wonderland of economic opportunities is really intentionally closed against them, that those windows are really small. And I know that at Sakhi for South Asian Women, Kavita leads incredible work with respect to economic justice and economic security for survivors of gender-based violence. So Kavita, I was wondering if you would mind speaking a little bit to that intersection of economic security and gender-based violence, especially in the time of COVID.
Yeah. And thank you to everyone at Law and the Margins, and to the Shamtoli and Margarita for hosting, and to my fellow panelists, who I am always in awe of. So to provide some perspective, many of the survivors that we work with really live at the margins and on the fringe, in terms of their own life, in terms of their own economic stability. And what we see at Sakhi is many of the survivors we work with really are living paycheck to paycheck. About 30% of the survivors we work with are employed, and I would say 90% of those survivors are hourly waged workers. So when the pandemic hit and really things started to unravel, our team on March 12th started to do a lot of aggressive safety planning and aggressive outreach to the survivors we work with. And the first thing that really started to bubble up is the palpable fear, anxiety, and depression that survivors were experiencing for for job instability, for economic instability, for housing instability, and for food insecurity. And in addition to that, they were also processing their trauma as survivors of gender-based violence if they were living with their perpetrator or if they were not living with their perpetrator. All of that entire experience has been highly triggering. And so we saw this moment where we were actively trying to think of how to support survivors as they were in this really heightened state, and they were facing such significant instability, as we all were. But for survivors, especially those who are really in the early parts of their healing process, stability is so critical. Right? It is a grounding mechanism for us to be able to find our coping, our ability to cope through trauma. And so what we were actively doing then is trying to address the economic instability, this sort of like floodgate of issues that were happening at that moment. And so we revamped our food justice work. So we have a food justice program, like I believe several of the organizations on the call do. And so we started to do non-contactless grocery deliveries, where we hired a full team and we're feeding anywhere between 100 to 130 survivors in any given week. We've distributed close to 5,000 pounds of fresh food from March 12th until today, and are actively going to continue this work to ensure food security. We're also doing a lot of work right now around housing security. So between now and the end of the year, we expect to distribute about $100,000 specifically to support survivors in housing stability as well as economic stability, so that they can pay their bills, their utility bills, their cell phone bills, all of those critical things that we need in order to survive. Because what this pandemic has clearly indicated is, as it continues to impact Black and Brown communities from a public health perspective, from an economic perspective, that is also evident as well. Right. And so we're talking about communities that are already living on the margins. And so we have been pushed so far back at this point by the destabilization that this pandemic has impacted us with, that, you know, it is going to take us years to unravel. And we're still trying to come out from 2008. Right. And so here we are yet again trying to work through this moment. The most vulnerable members of this community that we work with, of the survivors that we work with, are undocumented survivors who don't have access to the government relief package, as Zeinab was saying, right? And so what options do they have to lean on? And you know, if one is a undocumented survivor of gender-based violence and tests positive for COVID-19 and has 2 children, please tell me what their options are, right? It is organizations like ours. And we've had a case like that, and we've had many cases like that, and I'm sure my colleagues on this call have also had cases like that, and that is the role that we are continuing to play, and so that's where we are right now.
Yeah, thank you so much. Let me pause there really quick, one, to make sure that Niketa gets an opportunity to wait and say hi, since the technical issues have been ironed out, and she's now on the panel with us. Welcome, Niketa.
Hi, Margarita. Thank you. And I've been on. My camera was not on, but I've been on the whole time, and I've been listening. And thank you so much. And I really appreciate where this conversation is going. I'm really happy to be part of it. Thank you.
Thank you. And just, you know, one of the things that that Kavita had mentioned was talking about economics and inequity, and we know that those are inextricably linked. You know, at the end of the day, capitalism requires an underclass, and white supremacy and patriarchy work together to ensure that Black and Brown people and women and trans and gender nonconforming people will always be disproportionately low income. So I wanted to spend a little bit of time sort of unpacking in that direction, right? In addition to sort of economic structures, institutions have been charged with maintaining inequity. With law enforcement at the forefront of upholding problematic legal systems that feed private prison industries. And what amazes me is that in this context, right, and what you have heard Zeinab and Kavita lay out, this like extraordinary fear by immigrants even to access healthcare for fear that they might get deported because they got healthcare. To hear Kavita talking about, you know, people's basic needs for food. And I don't know if you just shared it, Kavita, but I've heard Kavita share that people asked, you know, like, will this have implications for me on public charge, but I'm accepting the food you're giving me? So all of this fear that has come up. And what amazes me is that in that context, we ask immigrants and women of color to call the police when they're being abused. So what I'm going to focus my comments on is that intersection of racial justice and gender-based violence at this moment, especially with respect to law enforcement. So, you know, the reality is that violence against women and girls increases our risk of incarceration because our survival strategies are often criminalized. There was a study of women at Rikers Island some time ago that found that the majority of women who had experienced domestic violence prior to incarceration reported engaging in illegal activity as a response to threats, coercion, and violence by a partner. And what's more, a racist system is always going to enact laws in a racist manner. So in New York State, we have what's called a mandatory arrest for violations of orders of protection. It was actually a really big point of advocacy, you know, a couple decades back. And what it means is that if cops are called to a scene and there's been a violation of an order of protection, they have to make an arrest, no questions asked. They don't have the sort of decision-making power, the leeway to decide not to make the arrest if there's been a violation of an order of protection. And that sounds like a really great victory, right? Well, not if you're a poor woman of color. Of survivors in New York City who had been arrested along with their partners, right? So, because remember, mandated arrest means that they're going to arrest somebody. It often means they're going to arrest both of you, especially if you're a woman of color. 66% of all of the people who had been arrested along with the abusive partner who actually had the order of protection against them were 66% African American or Latinx. And 43% of them were living below the poverty line. 19% of them were receiving public assistance at the time. So again, it begs the question, why would you call the police if you're far more likely to get arrested along with the person who is abusing you, even with all of these protections in place, like mandated arrest? But the movement to end gender-based violence has been so focused on getting law enforcement to take domestic violence seriously that the field itself has largely abandoned any other potential solution to address the issue. And you know, I and other folks refer to that as carceral feminism. That is not something that people will normally identify themselves as. I am a carceral feminist, but I think that when we are talking about that over-reliance on the criminal legal system as a unilateral response to domestic violence, and you think that that is the only way to get this to end, that's carceral feminism. And in the midst of this pandemic, we are experiencing an explosion of visibility regarding police brutality and its history of targeting Black community members with violence. And this gives us an opportunity to consider the role we've had in our field against gender-based violence and to reimagine responses to it. So the question we're asking ourselves now is if we are willing to acknowledge that criminal and civil legal systems, it's not just the criminal legal system, I think the civil legal system is on the hook as well, have played such a huge role in the subjugation and state-sanctioned murder of Black and brown bodies, then can we trust them to safeguard Black and brown survivors of gender-based violence? And the answer, I think, that we have learned time and time again when anybody bothers to ask Black and brown women is that it cannot. By definition, prison, jail, and police are coercive constructs. And the decision that we're looking at now, the decision we have to make as a field, is whether we want to pursue the pattern of punishment for the crime of domestic violence or sexual violence, or if we want to explore transformation and behavior change for those who are acting abusively. And at VIP, we are working to build out capacity for restorative justice and community-based accountability practices. And I'm going to share a little bit more about that when we talk about collaboration. So thank you for giving me a time slot on this as well to be able to speak to that intersection. I'll pause right there, ask if Kavita, Nikki, or Zeinab want to add anything to what I've said before I move on to sort of the next thing we wanted to address together.
I just wanted to add, thank you so much for really clarifying, the intersections. And I think when we look back, we have to understand how, the larger institutions who advocated mostly for, using the state mechanisms to end, prevent or end domestic violence or address, violence in the home, we're not interested in thinking of how the state systems would impact different communities differently. For example, I think that the knowledge that the state system would, really be violent and not be safety systems for communities of color or immigrant communities was never actually in the foreground of, the advocacy around those systems. So we have to bear witness to that. And I think for us as, organizations working at the margins, what can we do to change that narrative? And what can we do to speak back to power to ensure that those systems no longer, they don't address anything and they don't promote safety, even for the victim of domestic violence that we, the system purports to protect. Because at the end of the day, if, as Margarita said, both partners are arrested, what does that mean for the DV victim who is being arrested with the perpetrator and taken to jail at the same time?
Thank you, Zeinab. Can I ask the panelists if just one quick follow-up on that before we move on? And I know we have a lot that we want to discuss. But what would you all say to the response that the answer is not for that police officer to not be there? The answer is for that police officer to have better training, for that police officer to do a better job of assessing, who is the person causing harm and who is the person who is being harmed. Like what are your thoughts about the notion that police just need better training?
Margarita, I can share a little bit about that. Womankind has been around for some time, and it's not. In some past years, we were invited to we were in a similar scenario as you're describing, and we were asked to participate in a relationship with NYPD, particularly around some of the human trafficking efforts. And it was very challenging for organizations like ours in that situation, because it's very important to make sure that we are providing our knowledge of what does trauma-informed approaches of, intervening in that situation. This particularly was around those who are elder who experience domestic violence, and also for human trafficking. It can be very tricky. I think it's, maybe this is very controversial. However, I do believe that organizations like ours can be positioned well to educate and provide training. And hopefully the part that we won't be able to see and follow through with is that training going to be used in the appropriate way in terms of the execution. And it does require a partnership and some sort of open feedback on what that would look like. And I do believe that, so I'll just use this one example. We shared very openly feedback on when someone is being arrested, a family member should not be used as a translator. So if a young daughter is standing there, she should not have to translate for an apparent, because it puts everyone in obviously it's a very difficult situation. And that feedback was taken. So I do believe, and maybe I'm, eternally hopeful, but I do believe there could be opportunities there. But just coming back to some of the points that you said, this is a really interesting time, because even just NYPD and the riots that are happening, it's re-triggering for so many of our clients. And I don't know if many of you have been experiencing that. Many of our counselors are helping our survivors. And because of that trauma that can be re-triggered, it is even less likely that we're seeing that our survivors are turning towards, law enforcement for support.
Right. Thank you.
I think what also came to my mind is for someone who experiences trauma, and then to immediately call upon an individual who is carrying a gun, I have to imagine there's a better system out there, right? And especially if one is experiencing violent trauma, to have someone with a gun enter their home, right? There is nothing trauma informed about the police coming into one's home. There are flashing lights. There's like an obnoxious vehicle. There is usually this sense of power that automatically that is assumed when an officer enters one's home. And quite frankly, what happens when an officer leaves is that situations often tend to be worse, right? Because the perpetrator is further ignited and now knows that they can cross yet another boundary. And so leaving oftentimes survivors in a very vulnerable state. But yeah, to your point, Margarita, I think we all have to assume that, you know, it's not about training. It is about the fact that the system is not designed to support survivors of gender-based violence, right? The system is designed to enforce a particular type of state control. And that is the last thing that a survivor needs, is another form of control.
That's right. That's right. Thank you. Thank you for that. And thank you all for responses in the chat. I've really enjoyed following it, and just want to thank some of the folks who have named themselves in the chat. I want to thank Sanola, Bharati, and Lorraine for naming yourselves, and Q had named himself a little bit earlier, and Nad, Trin, thank you so much for your responses. This is such a big topic, and one that I know is, you know, really charged, and that can be the topic of, you know, many webinars. But I did want to sort of be able to like ask all of the viewers and listeners to sort of come down from somewhat of a heady place that we sometimes get into when we're talking about these issues, and ground ourselves in some of the human impact of the ideas and the statistics that we've thrown out. And so for that, I'm going to turn to Niketa Sheth of Womankind to ground our conversation in the very real impact of GBV during COVID. So with that, I'm going to mute myself and ask Nikki to share a story or some about what she has seen on the ground.
Thank you, Margarita. And I appreciate the importance of shining light to what is sometimes a dream that can't be realized in this society that we live in, and the challenges around control. So as we've heard, I think we certainly know that the economic instability and the food insecurity and the public health crisis has posed so many challenges to survivors. I want to share just a little bit more about what that looks like for some of our survivors. And I invite all my colleagues to join in. I want to share a story about a mother with 3 children. She reached out to us early on within the pandemic, sharing that she wasn't quite sure how much longer she would be able to stay in her situation. And it was especially hard for her because the only time that she would be able to feel a sense of relief was when she would be able to step outside, go for a walk, and maybe pick up some groceries. And without having any space to be in a 1-bedroom home, it created absolutely no space away from her abuser. On top of that, we learned that her abuser, her partner, was actually hoarding some of this food stamps, making it even harder to access food. We later then learned that the local grocery store, the only grocery store that was available that actually accepted those food stamps, was over 3-4 miles away, which is a very long walk, if you can imagine, with many children. Some of the things that were especially difficult for her was just continuing to endure not just the physical abuse, but the emotional abuse, and to expose her children to this abuse while she was also trying to support her children, 2 of whom were participating in homeschooling. I just want to highlight a little bit more about that component, because one of the pieces that is often forgotten, that some of you who are on the call today, is realizing what this moment brings for survivors who may not be able to have the resources, may not have a paycheck coming in, may not be qualified for unemployment. And on top of that, are doing many of the things that those who are on this call who happen to be mothers or fathers that we're all potentially doing, which is trying to also support another human being and protect that human being. And it was a very difficult situation for our advocates. We in particular knew that this client was struggling with mental health and depression. And it was also very hard to be in touch with this client. Womankind, along with many other great organizations here today, have incredible ways found incredible ways to stay in touch, whether it be using chat features or really upping the safety and the approach of staying connected. So I just want to highlight that one of the greatest things we were able to do, and many organizations are doing, and I just want to really share this because it's so important right now, is putting cash in the pocket of a client in that moment. I think, it would be completely, it's sometimes forgotten that during this pandemic is not when the violence starts, it's when it's exacerbated. And so what's really most challenging, what was most challenging for this client, is to be able to stay in her home, have enough food, and not have to engage with already a very violent, unhealthy relationship with her husband, who she knew she could not access food stamps. Having cash in her pocket to know that she could feed her children. And at the time there wasn't sort of clear updates on what was going to happen around rent. To know that she could pay rent meant the world to her. And that kind of support, to know that she could rely on an organization that has the ability to put cash in the pocket right away, is huge. And I want to share that because Womankind, as many of you also have been doing, has helped over 80 families with $120,000. I mean, just imagine what $1,000 in your pocket could be in a moment like that. And it just gave her hope. And really, I just want to highlight the word hope because that's a really important thing at a time like this. Beyond that, every organization that's on the phone today has found incredibly innovative ways to be able to support survivors, even when you cannot get on the phone with them. And that's a huge deal. And I just, I shared this story because of the complexity and the layers behind it, but just recognizing the essential needs in that early time of the pandemic have to be remembered, and we take for granted the basics that can be taken away from you when you don't have access to benefits. At this point, we are still working with the survivor, and we are helping the survivor through legal support, through housing support, through what will be a path to eventually, at her choice, come into a shelter. And we always want to empower survivors to make that choice on their own. But I am very proud to say that to be able to offer cash assistance, which is something that I want to highlight, is not possible without the great support of so many wonderful organizations and philanthropic organizations that have been supporting all the work of our organizations. It's saving families' lives. So hopefully that gives you a little bit of a preview of what happened early in COVID, especially as it relates to food insecurity and many of the other struggles.
Yeah, thank you for sharing that example. It is really chilling to think about, a sort of a mother struggling with mental health issues exacerbated by everything going on, and then having one of the strategies of abuse by their partner be denying food, the basic need for sustenance. It is remarkable, the work that is being done in response to that. So thank you for sharing that, Nikki. And I also wanted to note that I think, Kavita was mentioning earlier a lot of the food access done there. And And Nikki noted a lot of the foundation and philanthropic support that has come for that. And I really also want to uplift a lot of the grassroots and community-based work that was done around the mutual aid movement to really help get folks out, get food out to folks and like basic needs out to folks. So I feel like having this sort of multi-tiered response, everything from the big deep pockets and folks who have lots of money down to people who are like, well, I have like 4 canned goods that I can spare and I'm going to do that. And I'm going to even take it to my neighbor's house for them, was an extraordinary response. And when it comes to really focusing on the experiences of survivors in the moment is something that counteracts the sense of alienation and isolation that gets really triggered while living in a pandemic. Let me ask if there's anybody else who wants to add anything about your organizational responses. Zeinab, I don't know if you had an opportunity earlier to speak a little bit to what Sautietu's work has looked like what your organizational responses have looked like in response to COVID.
Well, thank you. I'm sorry I missed that one, but I think what Sautietu has been doing is similar to what Kavita and what Nikki have been saying. And what we've done is actually try to stretch the few resources we have to go as much as we could. Cash is critical, so we couldn't afford to give up, $1,000, but we've made sure that many of our victims who've come to us, we've given them, $500 at least. We've made that, and we've tried to have partnerships with local area supermarkets to see, if a client, comes to your supermarket and says, I'm coming from Sautietu, please give them the produce and we'll pay you, we'll come and pay you. So we've tried to do those kind of innovative, strategies, including actually some, staff, driving to places to go, distribute food, to give cash, to make sure, even buying gift cards where they can then go to the store and use that gift card, to buy the basic needs that they need. And yes, you're right. I think that often we don't think about what someone might need immediately and, other than safety. I think Nikki is right. Having a bit of cash in your pocket is a big hope.
Right. That's right. And helps to restore some amount of control in a moment where everything is out of control. The whole planet is out of control, navigating this virus.
Yeah, not only control, but a sense of integrity and respect for yourself.
Right. Yeah, that's right. The dignity that comes with it is so critical.
Mm-hmm.
Thank you, Nikki. So did somebody want to add anything there? I'm sorry. I couldn't tell if I heard somebody starting the sentence or not.
Margarita, I wanted to highlight a different story if we have just for a moment.
Yeah.
A story a little bit more focused on NYPD. And I say that because we're focusing on law enforcement. I want to share this story because I believe this story very briefly represents some of the other experiences that some clients have seen. And this story was also recently shared with the press, with an article that came out in Politico. So I feel very comfortable sharing the story. So one of the things that has really taken us recently is a delay that we learned about from a client who waited over 4 hours after calling 3 times, 3 calls placed to NYPD. And this was a client who I will name her as Nina. Nina and her son, her 11-year-old son, was taken by an abusive family member, a brother-in-law, and thrown into a car and taken about 20 to 25 blocks away from her home in not appropriate clothing to be outside. And after calling 911, many of the response was not taken seriously. From her perspective, because she was safe and she was not physically abused and did not need to be in a hospital, it wasn't quite clear if that was being prioritized. She called a second time. At this time, there was some sort of confusion on which location to come, and she made it very clear where she needed to be. At this point, and I'm sharing this because I just know there's so many fabulous people here on the chat that I can see are very passionate about this work. Imagine in this pandemic, we're trying not to expose ourselves to individuals. Imagine someone who sees her on the street and this man comes out and opens his door and opens up his entire garage so that this woman, Nina, and obviously that's not her real name, I'm protecting her name, Nina and her son are coming into this man's garage. Imagine what it takes to come into a stranger's garage, a nice Samaritan who's opening up the door and decides to offer her warmth, decides to offer her safety, and decides that he's going to call 911. Calls 911. No, we're still waiting. Finally goes to the internet and looks up organizations, gets on the phone with us and speaks to our helpline. We have an advocate who speaks the same language as she does, and she's from Bangladesh, and is able to talk to her directly about this experience. I'm sharing this with you because this client, the survivor, is still outraged on the experience that she had to go through. There should never be a delay in calling 911. When she shared that her only interest was to make sure that she can go back to her home where she was unfairly kicked out by a family member, the police were not even comfortable confirming that they would assist her and take her back once she filed the police report, that they would allow her to go back and get her belongings. They weren't even quite sure if there was any sort of something that they could charge him with. And it was, so all she wanted to do is go back and get her immigration paperwork and anything else that continues to be in this home. This client and her son are safe at this time. And I just want to share that on one hand, it is outrageous to have an experience like this during the pandemic and not to be able to rely on 911. And on the other hand, I think there's something that's worth sharing, which is just the kindness that continues to exist in our community when a stranger can open up their garage and support someone. So I hope that that second story illustrates a completely different experience that really needs to be told.
Can you hear me now? Can I get a thumbs up if I'm audible? I'm not sure if you can hear me. Great, thank you, Zeinab. I am really technologically deficient over here. And Nikki, I just wanted to thank you so much for that story and sort of like a tale of two cities, right? You know, one where it is community that is responding with what is the immediate necessary response, and where institutions are slow and actually in this story never responded. So thank you for sharing those really heartfelt stories and for humanizing the conversation that we're having in that way. Theodora and Bharati earlier had asked about some of the collaborations that might be possible. So just a quick spoiler alert. These four groups that are on the call with you today, Violence Intervention Program, Sakhi for South Asian Women, Satyatu Center for African Women and Families, and Womankind, are all culturally specific organizations doing gender justice work in New York City. We are four of the only, there's not too many more, that are focused at this intersection and that are really focused on very specific community bases. All of us are serving immigrants primarily. So as you might imagine, collaboration work, it really matters for organizations like ours, because as you might also imagine, we're just not that big. We all wish we had a sort of like policy team and a comms team and, you know, like all these, you know, like lobbyists that can really do a lot of work for us. But we lean a lot on our team members who are phenomenal activists. And we end up doing a lot of some of the government-based advocacy on our own. So we have looked for a lot of ways that we could collaborate together so that we can have a bigger impact. Because we are concerned also about the way that mainstream DV organizations have over-relied on police. Don't, like as Zeinab was saying, have not, put us in the foreground, not just us personally, or the communities we represent in the foreground as they think through policy efforts. And that are not always thinking about the exact needs that the clients have. What I think is phenomenal when people were sharing what they've done organizationally is that all of us have done emergency cash assistance. Like these very small grassroots nonprofit organizations somehow found a way to give our communities money, which is supposed to be the scarcest resource available, but all of us did it. All of us have, I think amongst all of us, we've probably reached thousands of people with emergency cash assistance during COVID. And that didn't happen after after months of planning. That happened within COVID, right? That happened during the time that we needed it to happen. So I just want to really uplift that work and say that, we might be small, but we're mighty, and we are even stronger when we're together. So on that note, I wanted to ask Kavita to say a little bit about some of the policy collaboration that this particular network of folks have done. And then I'm going to ask Nikki and Zeinab to also add a little bit.
So thank you for framing that out so beautifully, Margarita. I love your lens. I feel like you have this way of crafting narrative that I absorb so much from you. Like, bring it, girl, bring it. And so it's true. About 18 months ago, Margarita really just, and this was, her vision was like, we need to formalize this process. We need to make this a thing, right? And so our 4 organizations, along with Black Women's Blueprint and Women for Afghan Women, received seed funding, and I mean super small but super mighty funding from the New York Women's Foundation, and we pitched them this idea of creating the collective, and as culturally specific organizations that serve. Let's be real here. Most of New York City, if we add up all of the immigrant communities that we serve, this is New York City right here. We realize that there is such power in the work that we do and us coming together. So the way that we approach our work is quite distinct, right? The language that we use is quite distinct. Some of our service offerings are quite distinct. But what we have in common is really the fundamental belief that survivors must be centered through the course of this work and through every moment of their healing journey, right? And so with that in mind, we have come together as a collective, funded by the New York Women's Foundation, to bring an outside facilitator to help us craft values, a mission statement, and to come together. Through the course of that, what has also happened very organically, and I think because there's much mutual love and admiration amongst our group, that we've pulled each other in, right? And so when we're pitched for media ideas, it's really easy to want to tap into that sort of white supremacist idea of saying, I'm going to hog this moment for myself. Actually, no, I want to bring in other voices to the table because this makes the work richer, right? And we need to uplift all of the communities that we work with. If there are funding opportunities available, we do the same, right? We have the same conversation, thinking very much in mind about, this needs to be shared. All communities need to feel the type of support that we're feeling, because when we're starting to pit against each other, right, that is once again falling into the same trap of white supremacy and really holding back our work. That is the model that we want to continue to dismantle. And then I would say on the advocacy efforts, especially around the task force that the governor had created in response to COVID. And, we were asked by some folks on the task force to give the on the ground perspective, which I thought was fascinating. But none of our organizations were actually part of the task force, which again was fascinating. And so, right, linking up creating that strategy and really lifting up what our communities are facing to ensure that that greater narrative is being brought to the governor, and what's being published through his paper. And so thinking very strategically about how our communities are richer or stronger and stronger. And for us at Sakhi, we're doing a lot of self-reflection right now. This is a particular moment for us. We've been in a tremendous phase of growth. We've grown, I want to say, close to 300% in the last few years. And, we're now at that moment where we're like, we need to talk about how we hold prejudice at Sakhi, what that looks like, how we hold privilege at Sakhi. And this type of collaboration, this linkage that we have, that we find so deeply important, is critical to that process.
Absolutely. Thank you for that. I really appreciate it's great to hear sort of like a process that you've been part of from some, the perspective of another person in that process with you. It helps you to reflect on it differently. So thank you for sharing that. I want to name 2 additional groups that are part of that collective that are not on this panel, and that is Arab American Family Support Center and Black Women's Blueprint. Are all the 6 groups that are doing that work to create a sort of multiracial, multicultural policy agenda on behalf of gender-based or survivors of gender-based violence. I'm sorry. Okay. So Nikki, I also wanted to ask you if you can say a little bit.
Thank you. Margarita, I was saying thank you.
Oh, no problem. Thank you. Then I wanted to ask Nikki if you wanted to say a little bit about sort of like, as women of color specifically in leadership, what collaboration has looked like for you, and for folks
Thank you for sharing that. I also just want to say that I hope everyone's attention is on this great live webinar, but there's also a crazy storm going on outside. So if you're doing that, please, avoid the background noise of the thunder. So I speaking of storms, it has felt as if we've walked into the storm, not just trying to support so many of our survivors who are living through a storm, but I want to acknowledge and be vulnerable around what leadership looks like at this time. And to be clear, no one really knew the way and how to walk through this pandemic, and there was very little support. So when I think about your question, Margarita, we had talked about the idea that in crisis, people really do go back to that scarcity mode. And that is the complete opposite of what we've seen as the leaders, the women of color who are in this collaborative, who even beyond this collaborative, all of whom we work across within the sector with the shared values and principles that drive us to make the choice to choose to be incredibly collaborative. I'm sorry, it's like a lot of noise in the background. And to choose to take the time to support one another where there is no direction and how to go about and pivoting programs. I remember the early days, it feels like an eternity ago during this pandemic, of so many decisions that each of us had to make. And the number of calls and texts and late night conversations on how can one pivot at this time? Is it safe? How can we keep our staff focused on safety, but take care of themselves and their own self-care? How can we focus on supporting other women at this time, supporting other mothers at this time, supporting other caregivers at this time, supporting all, right? And it's just so important to be able to truly think about our roles and what does it mean to lift each other up as human beings. And at a time where very little direction was given to organizations and heads of organizations on how to go about and doing any of this. So we, luckily, I believe, we are in a more supportive place because we're all learning from one another. But I feel incredibly grateful for the many women in leadership roles that know to come together rather than to split apart.
Margarita, can I add just one quick thing?
Please do.
I just wanted to say also among the groups that are on, in this coalition, I think one of the things that we shared on early on was that we would bring in all our vulnerabilities and all our traumas and really be authentic and honest about being a part of the group, and that we wouldn't, hide it. And I think, because as, women of color leaders, we always, I think, are assumed to be these super women, who can do everything. And we wanted this space to also be a different space where we can actually really, share our struggles of really not only just what our own communities are looking at us and, saying about us and the organizations that we run, but also the larger institutions, like, for example, the task force coming to us and tell us what the facts on the ground are, as if, we're the only, deposits of that information, but can't be actually, agents at the table, don't have the right to be at the table. So having these multiple spheres where you're always negotiating and you're always, trying to see which one is lesser of the two. We wanted this coalition to be a space where, as leaders, we can really actually nurture, support each other, but also challenge each other to raise above, because we do know that we do have the potential.
Yeah, thank you. Thank you for that. I agree with my colleagues here. Perfectionism and this sense of invulnerability perfectionism is like white supremacist shit, right? That we all are expected to play to. And there was something that Nadine, who I had mispronounced as Nad earlier, my apologies, but Nadine in the chat had mentioned, which was, when somebody calls the police, they're usually afraid for their life and there's no other response to that. This is all going to come together, I promise. Give me 2 seconds. And I think that I was in the context of like a racial justice conversation, thinking about how often when we say this is messed up and needs to change, and the response we get is, well, what's the alternative? You give us a perfect plan that we can implement, because there has to be some sort of perfect alternative to the police if we're going to explore or move in a different direction. And something that Mariame Kaba, who is a brilliant abolitionist and is one of the co-founders of the Just Practice Collaborative, and I really do recommend, if you were interested in learning more about transformative justice, restorative justice, and community-based accountability as a response to domestic and sexual violence, that you look up the Just Practice Collaborative's work. They're a collaborative that I would uplift in this conversation about responses and collaborations. And her name's Mariame Kaba. She had an op-ed in the Times a couple Sundays ago that said, yes, defund the police actually means abolition. Something that she taught was, we can say like, not this. Right? That this is not working. And so we deserve to be able to explore different options. To say not this is enough. And I really appreciate that sort of wisdom. And on that front, and thinking about how we create different sort of opportunities for what can be true, what can be a reality. There's a restorative justice collaborative that maybe some of the folks on this chat are part of, that was recently funded through the Trinity Church Racial Justice Initiative to do capacity building work within organizations. So Violence Intervention Program is one of those organizations. I know that Connect is there, Rising Ground, Steps to End Family Violence, Arab American Family Support Center, all these groups, and it's all held by the CJI, the Center for Justice Innovation. Are actively spending the next year really looking at how we build capacity to create different community-based responses to intimate partner violence. So we're at the very beginning of that, and stay tuned. I'm really excited for that. Really looking forward to what that collaboration will yield. And it is really based on, and here's another resource if you're interested in this. Purvi Shah was a consultant with the city, with the mayor's office to end domestic and gender-based violence, to create a blueprint that's called Seeding Generations, and it is a blueprint for restorative justice practices in New York City. So there's a lot of information in there. She did a ton of research and talked to people who cause harm, as well as people who experience violence, advocates, electeds. You know, she did a great research there. So I really recommend that. Just looking at the time and thinking about the sort of last question I want to pose to the panelists, and then see if there's any questions or comments that folks on the chat would like us to respond to. I'm sorry, let me pause there. Were there any other collaborations that people wanted to offer up before I move on to the next item on the outline?
Kavita, I thought that it'd be great for you to highlight a little bit more about a collaboration just that happened so quickly and I believe it represents every organization around those who are supporting communities of color, focusing on domestic violence and gender-based violence. Just the incredible op-ed that you were the brains behind. I don't know if you want to share that, because I think it's very timely.
Yes, please.
Sorry, storm, shattering doors. Let me mute myself here.
Are you okay? Yeah. So we a few of us on the call. So Nikki, Margarita, and I co-authored a piece that was. Is this what you're talking about, Nikki? Am I getting this right? Yeah. Okay. Sorry. I'm sorry. Co-authored a piece which was picked up in City Limits to talk about the proposed budget cuts in discretionary funding for fiscal year 21 by the de Blasio administration, and really also thinking about how it's part of a larger strategy about what we are expected to do in the course of our work is address what is on the ground, hold our staff, fundraise, and then thought leadership, right? And so, how are we doing this and navigating through all of this in the midst of a pandemic? And also there's like a crisis, and we work with organizations that are serving crisis. And so what we found through the course of this process too was that, let's be real, like the media has limited appetite for our voices, right? Like we had to shop that around quite a bit. We had to have conversations with multiple outlets, and we were fortunate that City Limits was like, yes, all over it right away. And I think it's worked to our advantage, especially because it's a publication read by New York City government, or those who work in government in New York City. But I think it's yet another reflection of like, who controls the narrative? Where is there space for our voices? And by extension of that, where is there spaces for our community?
That's really wonderful.
Okay, can you hear me?
Yeah.
That's thank you for that, and for sharing, Nikki. Thank you for sharing the link to the op-ed, because we have so much time to write op-eds, but we also really needed to make sure that opinion got stated, because we are very tired of being continually underfunded, and our services being so in demand. Wanted to pose the final question to the group, and then see if we have any additional questions from the chat. But the last question I had, we kind of started out with what is happening right now, what are we doing about it? And so as a sort of pivot to open question and answer, I wanted to ask what comes next? And I wanted to ask that of the panelists, and would love to, if people in the chat would also put in what you think comes next. Then I'll make it a little bit shorter. Like, what do we think that the next 6 months are going to look like for survivors and for the work that we do? I'm so sorry, and it's open to all. So I'll ask somebody to go on ahead and volunteer. And my apologies for the delay. I just can't figure out how to mute and unmute my phone without opening 20 windows. It's my fault. Sorry for that. And thank you for your patience. But if somebody can start us out.
I could start us out very briefly. We hope for the best for our survivors, and we will do everything it takes to support our survivors. There are realistic challenges ahead, and we know already from many survivors we're speaking to that there is a real desire to connect in person as soon as possible. We also know that childcare continues to be an issue to access the supports that are needed. I want to highlight in particular the challenges that so many survivors have been facing, those who've been on pause, essentially, based on certain courts that are closed, certain sort of statuses of filing for certain visas that have just been put on hold. And it will be interesting to see what might be the guidance and the choices that are being made given so many additional challenges that survivors are seeing right now and choices. The main thing that we're seeing is an obvious desire to be able to get back into the workforce. So many of our survivors have lost jobs. And so I think this is really an opportunity for organizations like ours and so many others who are volunteering or committed to this space to think about what does it mean to support training and around job readiness, whether that be soft skills or just even more familiarity and strength around use of technology. And so I'll end with just simply saying that one example of something that Womankind's been doing is really rethinking the way that we support survivors around preparing for what might be a long-term career, starting with what might be soft skills that is upon interest. What does it look like to actually begin to pursue what might be a completely different career path? And also the obvious desire to potentially learn to speak English, take ESL, and just build that skill set while being able to stay afloat. And that's not an easy thing to do, to have counselors and advocates that are helping you through that process so that you're thinking about the longer term needs of your family is really important.
Yeah, I concur with Nikki's suggestions. So in addition to the direct services that will still be required in the next 6 months, I would say, if you are of a voting age, you can vote as an immigrant or you're an American, mobilize everybody in your family to go vote. Because we really need to have people in policy making decisions in the administration that will really have empathy and be a little bit kinder to people who don't look like them. And I would say that that's really one. And I think what also for Sautier to weigh very heavily is how long will this pandemic go on? We don't know what is gonna be in the next 6 months, whether what the outcomes, whether the virus will be as ferocious as it is now. So now and then we have to worry about our staff, the safety at work, and if the city opens, what kind of protocols do we need to put in place to make sure our offices are compliant with physical distancing? So we have to think about that. Then in addition to continuing to protect our victims and survivors, because I can definitely see in the next 6 months, with the economy being impacted, I worry that it's going to be tougher for immigrant victims and survivors to get any support or assistance. And so we really have to work very hard, to think about what else are we going to be doing to protect them and their children.
That's right. Thank you. Kavita, would you like to add anything there?
That was so beautifully said by Nikki and Zeinab. Yeah, I mean, I think the only thing I would just continue to lift up is that we are going to see the bottom fall out from under us, right? We are facing an economic catastrophe in terms of being able to recover from this moment is going to take us a long time, right? The recession can be anywhere from 12 to 18 months, but for those who live on the margins, that process of unpacking and just restabilizing, it takes much longer, right? We're also living in a time where immigration is severely curtailed, and so we're seeing all of these forms of trauma layered upon layer upon layer for individuals who have experienced such grave trauma already. And so what we are gearing up for is not only to work with survivors to ensure to the best of our capacity their economic stability and their support through food security and housing security, but also to think about what the mental health toll will be, and to think about the anxiety and the depression that the ripple effect of that, as we all come out from under this moment, right? And we know that we're not done, right? Like, no one knows when this is going to end, right? Right now, everything is, okay, sort of, for certain communities, but the communities that we work with don't have, country homes that they can go to. We most of us live in small apartments, and so thinking about the toll, the community trauma, and also thinking about how do we brace for what's next, because that's what's next is also going to be potentially a second wave, right? And so all of that coming together is what we're preparing for.
I agree 100%. I think that there's a mental health crisis unfolding, and that people experiencing, abuse, literally trapped in a home with an abusive partner, are going to have extraordinary needs with respect to post-traumatic stress. And people who already had underlying mental health issues are having those exacerbated in ways right now that are so terrifying for them. So I think that there is an extraordinary need around mental health resources, and especially at the intersect of trauma, that organizations like ours are going to be asked to sort of respond with, and an agreement on economic justice work. And just wanted to share a couple things that VIP does with respect to that. Lorraine Correa is one of the sexual violence advocates in our sexual violence project, and she's on the chat right now and offering up resources because she's super amazing that way. But it is also one of the only programs that we're aware of that is a culturally specific program working with primarily immigrant Spanish speakers to address complex sexual trauma. And we know that this situation has triggered so many people's experiences of trauma, whether they're being sexually assaulted right now or not. So a real shout and uplifting to the people who are doing that trauma work and who will be doing healing work with respect to this as part of the fallout. And the economic devastation, I mean, we just cannot even, I seriously cannot get my head around what this will mean and for how long it will mean it. The implications of this are just that vast and that intergenerational. So one of the things that we have at VIP is an economic justice project that really focuses on working with people who can't participate in traditional workforce models for all sorts of reasons, right? Maybe they don't have workplace authorization, maybe they're limited English speakers, whatever, maybe the trauma prevents them from being able to participate fully or gainfully, and helps them to build out small businesses, which can be just a supplement and a side income to whatever else they're doing to earn money. But for some of our clients, it's become their primary source of income. And it is a trauma-informed multi-session series that really focuses on unpacking what money means to the survivor, and elevating and dignifying talents and skills that they have and learning how to market that, so helping them with a business development plan. So I think that we're going to be doing a ton of economic recovery. We're going to be doing a ton of healing around trauma and mental health work. We're going to be doing a ton of advocacy around police responses to what this looks like. And we think we're tired now. So check on us in 6 months, check on your girls, because we're going to be pretty exhausted. We already are. Somebody in the chat just noted also facing, serious food and hunger crisis, which is of course the most infuriating thing, because there's just no reason why anybody should be hungry on this planet right now. But very true, and thank you for lifting it up. So I just wanted to, there's a few minutes left, and there was many questions in the chat. Just kind of working my way backward, Jordan had a question about guidelines around becoming more autonomous from police, especially maybe around health and mental health issues. And another resource that I would offer, in addition to the Just Practice Collaborative, is creative interventions. If you Google creative interventions toolkit, you'll see this incredible manual. Literally a manual was written on this for you, Jordan, by this phenomenal human being named Mimi Kim, who's a Oakland-based, a West Coast-based advocate, having done this work for many, many years. She had been in shelter work and had seen sort of the way, and I think like all of us agree, and to be transparent, the way that nonprofits can also be part of their own industrial complex and cause a lot of harm, especially because so many of us are mandated reporters and then involve people in systems that doesn't help anybody, right? So acknowledging the harm that nonprofits can be a part of as well. She created this toolkit called Creative Interventions that's really focused on creating community-based responses to intimate partner violence, but also is really transferable to other issues happening within community, including mental health crises. So I wanted to offer that up in response to that specific question, and pose another, and then ask my colleagues if they have anything they want to add to either or both questions. Somebody was asking about advocacy efforts towards providing special emergency protection for documented and undocumented immigrant survivors of domestic violence, since they might not qualify for benefits. So if there's any additional advocacy that we're aware of, or resources or information in that area. So I'll pause there and ask if anybody else. I feel like the storm outside just quieted a little bit, in very symbolic meaning. If you want me to call on you, I will. But I invite you to unmute yourself. I will note really quickly there, while my colleagues are, maybe they're having the same unmute issues that I'm having. VAWA has not yet been reauthorized. And so one of the federal advocacy things that can happen, and this sort of blends well in with like a final call to action, which we wanted to close out with. Let me pause there and either show of hands or unmute yourself. Did anybody else want to speak to VAWA, or do you want me to do a real quick bit on it? I can do a quick bit. Okay, great. Pointing him. Okay, great. So VAWA has not yet been reauthorized. And the reason VAWA has not yet been reauthorized is that there are a couple of very big sticking points. One, Republicans, and I don't mean to be partisan, but some people in Congress are trying to roll back protections that were put in place for LGBTQ and gender nonconforming identified folks that were put in place in the last VAWA. So one of the sticking points is we're not going backward, right? And a demand that we do, that we cut protections to people who are LGBTQ identified. Another sticking point is called the boyfriend loophole, and that is connected to gun violence. It is saying that you need not be a spouse to have your gun taken from you once there's an order of protection in place. So the huge, you can imagine sort of like the NRA-backed lobbying that is happening with respect to that. So now VAWA is actually kind of fighting the NRA, and that has held it up a little bit in Congress. Not just a little bit, it's been years now since we've been able to reauthorize VAWA. So if there's a point of action that people would like to take, sorry, and the other rollback is around immigration. So the last VAWA gave a lot of protections with respect to U visas and T visas, and battered spouse waivers had already existed, but really added some additional protections and some additional opportunities to protect survivors, which made them eligible for benefits in addition to giving them status here in the country. So there's a lot of, that's a sticking point in VAWA too. So some advocacy that can be done is around those issues and really getting the feds to do something to continue protecting, and if anything, add more protections, not roll back what's available for immigrants. I'll pause there and see if anybody else has anything to add before we move to calls for action. That was kind of a call to action as well. And I think that Morgan is doing an excellent job of putting a lot of the resources, including ways to reach our organizations. Somebody had asked about immigration legal services, and I know that Womankind offers legal services. We don't at VIP. I believe Sautietu does, and Sakhi does not right now.
Yeah, Sautietu provides both. Yeah, we provide both immigration and family and matrimonial law. So, yeah.
Thank you, Zeinab. And Kavita was noting that you have what we do, which we partner with lawyers. Yeah. Right. So some of those orgs that we partner with, I imagine maybe our mutual partners are Her Justice. Herjustice.org is the way you get to them. The New York Legal Assistance Group, the Northern Manhattan Improvement Corporation, Legal Services of New York, Legal Aid. There are many organizations that do incredible work. Unlocal is a great immigrant advocacy group. And so there's many, and I just wanted to name a few of those. Kavita, did I miss any good partners that you want to make sure people know about?
I think Sanctuary, we sometimes partner with them, and then they're more culturally specific partners within the South Asian context. So particularly the South Asian Bar Association has been a strong partner of ours.
Great. Yeah, that's great. I was thinking of one other, but I don't think they do direct service. It's class action. So those are some great resources for people to follow up with. One of the greatest calls to action I think that we have is in our op-ed, which is write to the mayor, write to his chief of staff, Emma Wolf, tweet and post and Insta all of your demands that they not cut discretionary funding, which really goes a long way to support not just us, but all sorts of community-based organizations that are really small, usually not big enough checks, and this is some of the lifeblood that keeps those programs running and doing great work. Most of them are led by people of color and are serving people of color, and so it's a real number. It does a lot of damage to lose discretionary funding. So you can take action in that direction. Does anybody else want to offer anything in the last minute? Also included in our piece is the call to defund NYPD by $1 billion, at least $1 billion, not just $1 billion, and redirect those resources to youth and community-based organizations. So not only should you not cut our funding, you should cut NYPD's funding and give it to groups like us. That's our call to action.
One last, sorry, Margarita, I was going to add one more call to action, which is, and this conversation has really inspired that, and the idea that there are so few spaces for us to be able to uplift the work that our organizations are doing with our communities, that I would invite folks on the call, if they're ever interested, to want to also host this type of conversation, right? It can be really transformative and also help us spread the message of the work that we're doing. Thank you to Law at the Margins, as well as to Shantoli for making this happen. So just also inviting that out there.
Awesome, thank you. And thank you, Sarah from CSAJ, for offering that incredible resource. May I ask Law on the Margins if some of the resources that we've gone over here might be available on your website afterward, or how would people be able to, remember everything? Yes, thank you. Thank you so much, Morgan. So another shout out then to all of the panelists, Zeinab, Kavita, Nikki, all of you have kept my heart pumping for the last few months. I am eternally grateful for your leadership, and our communities join yours in strengthening and shining and making sure that our work is seen. And Chamtali and Morgan and Elbert for making all of this happen. Thank you very, very much for everything you're doing. And folks on the chat were really lively. I super appreciate that. What the hard thing about webinars is you never know who's listening or where it's landing. So that chat communication really helped to give us some energy. And all of the resources will be tweeted out on Law at the Margins Twitter page and also be on their website. So thanks again, and support Law on the Margins so they can keep these great conversations going.
And thank you, Margarita, as always, for being such a wonderful facilitator and for your leadership in bringing the coalition together. We love you. Thank you so much.
Yes.
Thank you.
Margarita, thank you so much for being a gracious
Exactly.
Thank you all. I appreciate it. All right.
Margarita.
Everybody have a great